नहीं, मेरे को नहीं दिख रहा यूट्यूब में, मैं तो नहीं देख पा रहा। नहीं, क्या करूँ फिर, नहीं दिख रहा मुझे। नहीं, मैं नहीं देख पा रहा हूँ, कैसे करें फिर? नहीं, मैं तो नहीं देख पा रहा हूँ, यूट्यूब पे नहीं आ रहा मेरे में। अब आ रहा है, ठीक है, थैंक यू। यस, वेरी गुड इवनिंग। यस, ओके। Yes, I hope things are fine now. Yes, Neha, Roshan, Himali, Nitya, Shrishti, Dr. MS, very good evening everyone. I hope you are all doing great. Preparation is on track. Yes. Okay, so today we are here to discuss the most important question series, MIQ series of physiology, right? Yes, very good evening. Yes, okay. And just the 20 questions. I hope you have all attempted these questions, right? So I will also be telling you, very good evening once again. I would also be telling you some, yes, Dr. Ajay, Roshan, once again, good evening everyone, right? So I'm starting the session now. So let's begin with the first question. The circuit below shown has an inflow yes, just give me a second. I think there is some error. Just give me a second. हेलो, वो नहीं आ रहा। Only 14, why? Anshita Jain, just give me a second. I'm just starting. Yes. So, yes, very good. Parallel connection. Rateria Himanshu, yes, questions were of decent level, I would say. So, somebody was telling me only 14. Lakshman Sivas, only 14. Why 14? You should have got at least 16 correct. Doesn't matter. Right. So, let's begin with the first one. Circuit below shows an inflow pressure of 120 millimeter Hg, right? So, inflow pressure is 120 millimeters of mercury and outflow pressure is 40. Remember, it is a good question because here we are discussing two concepts simultaneously. Resistance in each of the four vessels is 4 millimeter Hg per ml per minute, right? So what you have to do here is you have to use a simple formula for me, which is, yes, what do you have to find out? Blood flow. Q is equal to delta P upon R, right? Now, delta P is going to be, remember, the pressure with which the blood is coming in is P1. The pressure at the other end is P2. So, delta P would be 120 minus 40, right? This is delta P. Millimeter mercury, of course, upon resistance. Please see now carefully, these are a circuit shown where there are parallel resistances like this. If there are parallel resistances, then each of them is 4. Remember, the total resistance I need to calculate again, right? Which would be 1 by R is equal to 1 by R1 plus 1 by R2 plus 1 by R3 plus 1 by R4. Yes, absolutely correct. So if you see this now, you will realize that 1 by R is equal to, very simple one, just do 1 by 4 times. And I don't think I need to solve this for you. This would give me the total resistance R is equal to 1. Why? Because this would become 4 by 4. Now the resistance is 1. The delta P is 80. So what was the answer? Option number D, right? So slightly tricky one. Remember, this is based on which equation? This is based on Poiseuille-Hagen law. One numerical based question is expected in the exam every year from this. So it is a must know for NEET PG students as well as FMG. Remember, Q is equal to delta P upon R, but it can also be written like this: R is equal to 8 eta L upon pi R4. This is the Poiseuille-Hagen law, which can also be written as Q is equal to delta P into pi by 8 into 1 by eta into R4 upon L. Generally in the exam they are only asking you what is the relationship between blood flow and radius. Kindly remember, this is related to fourth power of radius, and resistance is inverse to fourth power of radius, right? This is the maximum they are have asked in the previous questions as well, right? Let's move to question number 2 now. Vibratory sensations depend on the detection of rapidly changing repetitive sensations. The high frequency end of the repetitive stimulation scale is detected by which structure? Remember, there are two types of vibration, as we say. The high frequency one, which is up to 800 cycles per second or 800 per hertz, and then the slow vibrations up to 80, right? So who detects the fast vibration? That is the question indirectly. High frequency vibration simply means fast. Fast vibrations mean up to 800 cycles per second, right? 800 per second. So what should be the answer? Remember, one question from the receptor, certain in the exam, very high chance. So please remember all the receptors with their functions thoroughly before going to the exam. Till now, I feel all of you will be knowing that what is the answer for this. Which one is for fast vibration? Yes. For fast vibration, the answer is none other than Pacinian corpuscle. Remember, deep pressure, poking, fast vibration. Merkel, one of the most expected question. 2-point discrimination. Why 2-point discrimination? Yes, what is the reason? Merkel has the smallest receptive field. This is also the reason we say Merkel is the better answer for Braille language of the blind. Please, no more controversies. Braille is the better answer for the Braille is Merkel. Although Meissner has also some role, but more stimulation is of Merkel. Meissner, slow vibrations, texture, topognosis. Slow vibrations is approximately 80 cycles per second up to, and texture and topognosis. Decent score, Atul Vadut Siddiqui. I'll tell you at the end. Don't worry. I'll tell you at the end. Yes, free nerve endings. What does free nerve endings detect? Yes. Anyone? Free nerve endings? Free nerve endings are for pain, temperature, and crude touch. Pain, temperature, and crude touch, right? So remember to revise again. I'm reinforcing the sensory receptor table from the workbook and the notes. Please do that, right? Moving on to question number 3. A 50-year-old man presents with complaints of difficulty in maintaining posture. Upon examination, the physician notices that the patient has diminished reflexes. Which of the following nerve fibers is responsible for transmitting information about the velocity and the length of muscle stretch? Yes, very good, CG. Pain, temperature, crude touch. Absolutely correct. Moving on to question number 3. Yes, what should be the answer? I am waiting for your response. Vidya Lakshmi, B. Sure about it? Please read the again. Velocity and length. Yes. Velocity and length of muscle stretch. Please focus here. Very good, Dr. Shayanjan, MS. This question was not there. No, Dr. MS. How come other people are answering it correctly? Dr. MS, doesn't matter. Please give your opinion right now. Yes, absolutely correct. Velocity and length of muscle stretch is a function of nuclear SS. There must be some problem, that means, but Kirti Abhilasha, doesn't matter. Please go through it right now. Okay, SK. I'll take care what happened there, because some of them are giving the right answers. So nuclear bag dynamic fibers. Remember, they detect both velocity and length of muscle stretch. This is the 1A fiber function, which are the afferents from nuclear bag dynamic, right? No, Sushmita ji, A gamma is for motor supply to the spindle. Yes, motor supply, that is motor supply to the spindle. You are getting confused. I am asking you afferents. There are nuclear bag dynamic, nuclear bag static, nuclear chain static. 1B is not the answer. Yes, who is telling me? Rizwan Hussain. 1B is from Golgi tendon organ. Afferents from Golgi tendon organ, right? That is not the answer. So 1A is the correct answer. Purpose of this question is, please go through muscle spindle before the exam. Another hot topic for the exam, favorite one, muscle spindle. GTO SK, क्या पूछ रहे हो? GTO, Golgi tendon organ. Golgi tendon organ. Achha, doesn't matter. So let's move to question number 4. Patient is undergoing coronary angioplasty. Dr. MS, static will be type 2, because remember, type 2 fibers are not on nuclear bag dynamic, right? So static will be type 2. I thought you know that type 2 is only for static responses, right? Static, only change in length, not rate of change of length. This 4th question is a good one. It can come. Patient undergoing coronary angioplasty for MI suddenly develops hypotension, bradycardia and apnea. Which of the following reflexes is most likely mediated by chemosensitive vagal C fibers in the cardiopulmonary region? Yes, very good. Basalt-Jarisch. Yes, it was a recent repeat. Absolutely correct. Basalt-Jarisch is the best answer. Basalt-Jarisch can occur by injection of, yes, it can occur by injection of capsaicin, viratridine. Yes, everyone, I can see all the right answers in the chat box. Viratridine, serotonin and phenylbigonides. These are the injection of these chemicals can cause or irritate the vagal C fibers, thereby causing both hypotension and bradycardia. Question भी बताऊंगा Lakshman Sivas, don't worry, I will tell you all the different ones. That is why I put this question. Hypotension, bradycardia and apnea. This is Basalt-Jarisch. Atrial stretch reflex. Let's go for the first one. Whenever there is increase in venous return, there is increase stretching of the atria. Increased atrial stretch can cause increased release of ANP, atrial natriuretic peptide. What can ANP do? Yes, can you recall for me some actions of ANP? Yes, I am waiting for your response. I will not write, you tell me. ANP, yes, what are the actions of ANP? Quick. ANP decreases the sodium reabsorption in collecting duct. ANP causes increased afferent arteriolar dilation, so increase in GFR. Very good, Sushmita. Medullary collecting duct is the best answer. That's excellent answer. MCD, medullary collecting duct. Yes, increased afferent arteriolar dilation. What else? And increased relaxation of, what is GMCs? Yes, please don't tell me that, sir, tell us the full form. Yes, GMC. What is GMC? Glomerular mesangial cells. Yes, increases surface area, more GFR. This together will result in increased GFR. Then what additional actions? It inhibits, decreases ADH, and it increases heart rate. Very, very important, right? Let's move to Bainbridge. Bainbridge. What will happen in Bainbridge? This can also be asked in exam. Bainbridge. On giving IV fluid, especially rapid IV fluid transfusion, this causes increase in heart rate. And you already know the mechanism. We have discussed in atrial stretch first. Then what is Cushing? Somebody was asking me Cushing. Yes, what is Cushing? Cushing's reflex. Remember, one definitely can come. Cushing's reflex. Yes, Lakshman Sivas, that's right. Whenever we have increase in intracranial tension, good. Due to tumor trauma abscess, this results in increase in blood pressure with reflex bradycardia with irregular respiration, resulting in bradypnea. So this is the Cushing's triad. Yes, increase intracranial tension, trauma, tumor abscess. Absolutely correct. I don't think I need to write that. Everyone knows. Trauma, abscess, tumor. Very good. So please look at this carefully once more. Hypertension with bradycardia, Cushing. Increase in heart rate, Bainbridge. Yes, very good. Kriti, everyone is correct here. Basalt-Jarisch, both blood pressure and heart rate reduce due to huge increase in vagal discharge. That's right. Please revise these. Very, very important. Moving on to the fifth one. Which is not true about MMC. Not true. False. A major determinant is hormone motilin. Absolutely true. They occur at the interval of 90 to 120 minutes in the fasting state. Absolutely correct. Function is to clean the gut before the next meal. That's right. But please remember, they get abolished after taking food. And they will be replaced by which contractions? They will be replaced by segmentation contractions and peristalsis. Yes, motilin is by MO cells, not M but MO or M0 cells. That's right. Remember, let's quickly recap migratory motor complexes. They occur in the interdigestive or the fasting phase. They get abolished on having meals and they are replaced by the contractions which occur in well-fed state. Normal duration is 90 minutes. One more question. What is the rate of MMC? Yes, quickly, quick answer. Rate of MMC, 5 centimeter per minute. Very slow. Phase 1, somebody has already written for me. Good. Phase 1, 80 minutes, no contractions. Phase 2, 6 to 7, irregular contraction. Phase 3, regular, only 3 to 4 minutes. Right. 5 centimeter per minute can be asked. Peristalsis is very fast, 2 to 25 centimeter per second. Read up about the GIT motility. It will hardly take 10 minutes of your time. Spend 10 minutes on GIT motility as well for me, right? Important topic, GI motility. Moving on to question 6. Which of these substances is secreted? Only Melody, if I get a chance, I will do that, right? I will do that at the last if I get a chance, right? If I have time, yes. Right now, let's discuss so that, everybody's time is crucial, right? So which of these substances is secreted by beta cells of the pancreas along with insulin? Very good. Absolutely correct. The answer is amylin. Let's recap amylin. 37 amino acid polypeptide. 37 amino acid polypeptide. Other name is IAP. What is IAP? IAP stands for islet amyloid peptide. It's a 37 amino acid polypeptide. What are its actions? Let's recap the actions. Yes, what does it do? It is secreted with insulin and amylin are secreted in the ratio of 100:1. It delays the gastric emptying. It delays the gastric emptying. Thereby it promotes satiety. It also decreases glucagon release. This is a previous PYQ as well. So amylin is important one. Please don't confuse amylin with C-peptide. C-peptide and insulin are co-secreted in the ratio of 1:1, right? So insulin is to C-peptide is 1:1, right? Don't mix them up, please. Insulin and C-peptide is 1:1. Yes, absolutely correct. Delays gastric emptying, everyone, and promotes satiety. Overall resultant action would be, because of all this, it is going to lower the blood glucose. It lowers the blood glucose. Yes, Anshita Jain, that's correct. Can anyone tell me one yes, proinsulin, IGF-1, that's right. So in the insulin, what else I would like you to know? Please remember, yes, amylin decreases glucagon. Over here in insulin, remember the islet cell distribution. Glucagon-like peptide is via the L cells, somatostatin delta cells, pancreatic polypeptide F cells, right? F cells. Moving on to question 7. Following a sympathectomy, a 66-year-old man experiences orthostatic hypotension. What is the explanation for this occurrence? Yes, remember this can occur on the clinical side, right? It can happen in the clinical side. So think about some answer for me. Question number 7. Following a sympathectomy, a 66-year-old man experiences orthostatic hypotension. Remember, normally the guy is lying comfortably supine, and let's say normal person. He stands up. As he stands up, immediately there is decrease in blood pressure. Because there is decrease in blood pressure, there would be, why decrease in blood pressure? Decrease in venous return. Decreased blood pressure, less stimulation of baroreceptors. Less stimulation of baroreceptors will result in more sympathetic nervous stimulation, less parasympathetic. Together these two will try to increase the blood pressure. Now if he is having orthostatic hypotension after sympathectomy, yes, very good. So what is going to happen? That means, is the baroreceptor response exaggerated, or it is not able to act? It is not able to act. So this is a problem, is now there is a suppressed response. Please remember, renin-angiotensin is a long-term acting mechanism. It will not be acting over here. This is a short-term response, right? This is not correct. And I hope most of you got it correct. Yes, baroreceptor चला गया. Very good, Lakshman Sivas. सही बोला आपने. baroreceptor चला गया, कम हो गया. चला गया या चला है ना, sympathetic में baroreceptor चला गया, उसका response कम हो गया. बिल्कुल ठीक. Very good. Suppressed. Moving on to question 8. The following physiological events that occur in vivo are listed in random order. Decreased cerebral spinal fluid pH, increased arterial PCO2, increased CSF PCO2, stimulation of medullary chemoreceptors. What is the usual sequence in which they occur when they affect respiration? This is a very, very good question again, because we are revising now mechanism of stimulation of central chemoreceptors. Yes, let's revise. What is the primary stimulus for central chemoreceptor? Don't say hypoxia. Hypoxia rather suppresses the central chemoreceptor. What is the primary stimulus? Increased in hydrogen ion CSF or decreased pH of brain interstitial fluid. Let's look at the right answer. First, I will have, yes, Anshita Jan, that's wonderful. So you got this correct, means that now in the exam you will definitely, all of you will get correct. Yes. So increased cerebrospinal fluid, PCO2, will not occur directly. Yes, why? So some people are getting confused. Let's recap. This is BBB, blood-brain barrier. This is systemic circulation. This is my medulla. Please look at the answer. Yes, most of you have given me correct. That's very good. So please see, over here there is increase in arterial CO2. This can cross and go to the other side. CO2 will combine with water and now there is increase in H+. So the first one was increase in arterial PCO2. This is the first option, A. Then increase in cerebrospinal fluid, PCO2. Then increased in hydrogen ion, this is right. And finally, this is going to do stimulation of the central chemoreceptors. Anshita Jan, I would like to say, and for other people as well, it is not like primary, secondary. Please remember, it depends on the choice. Primary stimulus is always hydrogen ion concentration in CSF. If that option is not given, then I will go with increased PCO2 in arterial blood, right? That's the one. Because hydrogen ion cannot cross and hypoxia rather suppresses. So the answer was of course C, and I'm very happy and glad that most of you have given me the correct answer today. Very good. Remember, along with this, you have to revise because in 20 questions we can't do everything, but the purpose is to list the important topics for you all, the ones which you have to read in the last month. Regulation of respiration. Please go through it thoroughly, both neural and chemical. Right? Type 1 glomus cell, oxygen sensitive potassium channel, then neural regulation, transactions, all those things. This is a very important topic. Ventricular ejection in the given figure, question number 9, begins at which point? Yes, Anshita, peripheral is hypoxia. Ventricular ejection in the given figure begins at which point? Look at the figure carefully, everyone. And I have some other questions also to ask you all. Ventricular ejections. SKC. No. Look carefully. Ventricular ejection. This is shown as aortic pressure. Yes. Suppose you have forgotten everything, right? You have forgotten everything. No, Anshita Jain, how can it be C? How can it be C? Look at this notch. Look at this notch. How can it be C? C is the aortic valve closure. Please look at the notch. Yes, very good. Answer is actually B. But please remember, suppose you didn't know this question. Can you remember the mnemonic? Yes, very good, SK. Ma'am Coco. Good. Ma'am Coco. Mitral valve closes. This is my first event. Yes. So point A is mitral closes. This is point A. Then B. Remember what is happening at A. Please look at the figure. What is happening at A? At A, the left atrial pressure. Yes. What is happening at A? The left ventricular pressure is more than left atrial. At B, aortic opens. Aortic opens. Point B. Which pressure will be more than which pressure? Left ventricular is more than aortic diastolic blood pressure. No, Anshita, that you shouldn't have done. Doesn't matter. That you shouldn't have done, but it is a practice. That is why these questions are slightly tricky. Then aortic closes, point C. You should have seen the notch, everyone. You would not have got confused, right? Then finally D, mitral opens. This point, left atrial is more than left ventricle. Okay, to everyone I will give you one more chance, especially the ones who got wrong. Please look over here. Let me zoom the picture. Yes, forget everything, one more chance. Yes, please give the correct answer now. Ventricular filling begins at which point? Ventricular filling begins at which point? Yes, that's right. At C, the left ventricular pressure is less than aortic pressure. But I have given you one more. Ventricular filling begins at which point? Please look at the options once more. A, B, C, D. Especially for the ones who were giving me wrong answer earlier. It is only for them. Ventricular filling begins at which point? No, Aki. No. Ventricular filling. Ventricular filling. No. Please look carefully. Ventricular filling. What is happening? What are you giving me the answer? At point C, the left ventricular pressure will become less than aortic pressure. That is closure of aortic valve. The filling, when does the filling begin? Filling means left atrium, this valve will open, blood will come into left ventricle. Yes, now I am getting the right answer. Good. D. This is an additional question. So remember, they are fed up of asking the usual questions of cardiac cycle. They might ask you in this way, right? Yes, that's right. After aortic closure, I will have IVR. Very good. At D, mitral valve opens. Ma'am Coco, mitral opens. Good. Let's move to 10. Diagram shown below is the oxygen hemoglobin dissociation curve. In this figure, P50 of the curve B in comparison to A is. Please see the figure. Yes, actually I gave it purposefully, Dr. Anshita, so that I can show you the other side as well, right? So I gave you this, although this question I had given earlier in one of the GTs as well. Yes. What should be the answer? Can I see that? Yes. Everybody is correct here. Let me see. Please see this. What is happening here is, in a normal curve A, remember this is 0, this is 20 and 0. So 50% saturation will be here, which is 10. So you have to do a lot of work for me here, but not difficult work. So in the normal curve, the P50 is coming out to be 30. So in the normal curve, P50 is 30, which is the normal oxygen hemoglobin dissociation curve, right? Yes, very good. Absolutely correct. That is a quick way to do. Very good. But if you don't want, I am first solving for you. But if you don't want to solve, then also, as Anshita has mentioned, I will tell you one more thing here. Now in left shifted curve at 20, at this 10 or 50% saturation, this is only 20 now. So this has decreased. Dr. Neha, it is 0. Please see. Yahi to karna tha. This was what you have to do. Please see again. This is 0. This is 20. So what will be 50% of 20? 10. 8, 10, 12. So it has become 20. So in a left shifted curve, the P50 has become 20. If you do not know this, you don't want to calculate, you are running short on time, please see the other way to get the same answer. In a left shifted curve, as discussed so many times, the P50 decreases in a left shifted curve. P50 is less in a left shifted curve. And I have been generous with you all that I have only given you one option with decreased. So that is the other way. You should have gone by this. I could have made things difficult for you by giving you one more such as this. Then you would have to calculate. But examiner is not going to be after your skin, so they just want you to know whether the concept is clear or not. Let's revise one or two more things here since we are discussing OHDC. Very, very important topic. Revise this please before the exam. Very important one. Yes, now please look at the graph once more for me and tell me some answers, and quickly you have to answer, all of you. This is B, this is A is normal. Yes. This is the oxygen hemoglobin saturation in percentage. This is B curve. This is C curve. This is D curve. Yes. Quickly, which one out of A, B, C, D? A is normal, of course. Which one out of B, C, D is for myoglobin? And I won't be writing the answers today for you because all of you know. Which one out of B, C, D is myoglobin? Quick. Very good. C is myoglobin, extreme left shift, rectangular hyperbola. B could be what? B could be fetal hemoglobin or bank blood stored in the blood banks. And finally, which one is carbon monoxide poisoning? Yes, which one is carbon monoxide poisoning? Option number D. That's right. This is the only one where left shift will decrease saturation, right? Very good. Absolutely correct. Again, expected question. They have been asking this in the INICET. They can repeat in the NEET PG as well, right? Very good. Let's move back to question number 11 now. Yes, good. Healthy 10-year-old boy breathes quietly under resting conditions. His tidal volume is 400 ml and ventilation frequency is 12 per minute. The following best describes the ventilation of the upper, middle and lower zones in this boy. Lower lung zones in this boy. Think about it. What should be the answer? Yes, very good. Easy mnemonic. I always tell in class, easy mnemonic. Yes, or you should have immediately got this correct. Immediately. What is the mnemonic? Somebody has written, or also for me, I think it was Anshita. Yes, very good. BAD. Very easy mnemonic. As I go from base to apex, everything decreases except what? Except what? VQ ratio. Right? Now let's look at the answer. Ventilation will be, yes, lowest in the upper zone, intermediate in the middle zone, highest in the lower zone. If you remember this mnemonic, remember I have told you in class, bad yaad rakhenge, so you will always good things will happen to you, right? So just remember the bad person of you, who is the bad guy in your life or the bad girl in your life, right? So bad. Base to apex, everything decreases except VQ. Good. Let's move to 12. Which of the following is the transported in intestinal epithelial cells by a sodium dependent co-transport process? Please don't tell me that I didn't know this and it is not a difficult question at all. Which of the following is sodium dependent co-transport? Secondary active. अरे डॉक्टर MS बैड इंक्रीज नहीं करना है, बैड हमेशा डिक्रीज होता है, बैड इंक्रीज कैसे होगा, है ना? बैड इज ऑलवेज गेटिंग डिक्रीज. डजंट मैटर, कोई बात नहीं, अभी आपका रिवीजन हो गया. Yes, that's right. Alanine is an amino acid. This will require sodium amino acid co-transporter. Very good. Fatty acids and triglycerides are not dependent on sodium. They require their specific fatty acid transporters. Can you tell me the answer to last one? Oligopeptide requires which ion? Separate question. Oligopeptide, yes, that is the spirit, Dr. MS. Good. Oligopeptide requires which ion? Oligopeptide requires which ion? You want choices? Okay, potassium, calcium, sodium, hydrogen. Oligopeptide requires which ion? PEP-T1 is a transporter, Aki. PEP-T1 is a transporter. You are right. Everyone is correct. But I am asking you the ion. PEP-T1 is right. It requires hydrogen. That's fine. Absolutely correct. Good. This can also be asked. So topic 2 revise. GIT absorption. Now I'm moving you to 13.1. This is a interesting question. No, calcium is not required, Dr. MS. It is hydrogen. Remember, hydrogen is required for di and tripeptides using peptidyl transporter or PEP-T1, peptide transporter 1 for di and tripeptides. Yes, that's right. 13.1. This is slightly tricky, but you should have got it correct. Body utilizes the negative feedback system to maintain homeostasis. The flow diagram provided shows the standard component of all the negative feedback system. Which component of the negative feedback system is missing at the point labeled X on the diagram? Please see the figure. There is a stimulus which is being detected by a sensor. Sensor is same thing as receptor. The receptor will bring the information via afference. Very good. That's right. That's wonderful. Doesn't matter whether you are doing by elimination or you know the answer. The purpose is to get it correct. The afference, this arrow brings the information to the control center. It further sends the information via efference to X. Now what is X? The missing part. So X is nothing, X is our effectors. And this effectors by negative feedback is going to bring the response. Yes. Let's find out the answer. Yes, most of you are correct here. That's very heartening. Good. Very good. Excellent. Good. Moving to 14. 300 ml. This is again a slightly tricky one. I want to know really who all got it correct. 300 ml of 250 milligram per deciliter mannitol is given to a patient IV. 2 hours later, a blood sample is taken. The concentration of mannitol in the plasma is 100 mg per liter. Given the patient has a total body water of 25 liter, what is the patient's intracellular volume in liters? Okay, doesn't matter, Anshita. I'll just solve it for you. Very good, Dr. Kirti. That is an absolutely correct answer. Excellent SS. Let's solve this. Yes, I know some people got it wrong, but please look what is the way to approach. So we have the mannitol. We are doing this simple question, but slightly I've changed it. So the mannitol is given in 250 milligram per deciliter or 100 ml. Now I have given you 300 ml of mannitol. 300 ml of mannitol would mean if it is present at a concentration of 250 milligram per 100 ml, then in 300 ml it would be, yes, that is the other way home I could have done. Very good. 300 ml would be, but I am purposefully doing with the traditional way. 750 milligram is the total amount. Now you know that Q is equal to C into V. So V or the ECF volume would be equal to 750 milligram upon 100 milligram per liter. You solve those for me. You easily get 7.5 liter as the answer. This is, remember, ECF. But I have given you total body water as 25 liter. So total body water minus ECF is ICF. So the answer was 17.5, right? Yes, that's right. If you calculate it like this, it will come as approximately not 17.5. That is the reason we have to do it in the traditional proper way. 25 minus 7.5. That's right. Perfect answer. Everyone understood now? Good. Over here, let's revise which are the indicators used for measuring various compartments. Yes, this is a very common mistake which Dr. Anshita has highlighted. Lot of people, they are correct up till here and then they mark A. Please don't do this. This will, decrease your rank by 1000 to 2000, because if you are able to get 7.5, you should get 17.5, right? So please don't do this mistake. What are the indicators? Total body water, DAT, deuterium oxide, aminopyrene or antipyrine, titrated water, tritium oxide. Very good, Sushmita, absolutely correct. Then we have the ECF, Manasi, MA-NASI, MA-mannitol, Na radioactive sodium, S sucrose, I inulin. Then we have the plasma, only one is the favorite, which is albumin, radioiodine labeled albumin. That's it, right? Let's move to 15. 17-year-old boy presents to, yes, that's right, presents to the emergency department with a cerebellar hemorrhage. On examination, he exhibits jerky eye movements, sways while standing, has a drunk-like gait. So he has the nystagmus and postural imbalance. Can you tell me what is the answer? Postural imbalance along with nystagmus, jerky movements, drunk-like gait, sways when standing. Enough of the hints. This is none other than a dysfunction of vestibulocerebellum, oldest portion phylogenetically. Very good, that's the right answer. Remember, revise the cerebellum: vermis, paravermis, spinocerebellum, motor coordination; vermis from axial muscles, unconscious proprioceptive; the paravermis from the distal muscles. And remember the lateral lobes, planning and programming. Yes, most of you got it correct. Good. Question 16. Ruchita, you should not have changed. Where did you get confused? That should not have happened. Which of the following reflexes is correctly paired with its receptor? That's an easy one. ये किसी का गलत नहीं होना चाहिए. This nobody should have got wrong. Which of the following reflexes is correctly paired with its receptor? Yes. Stretch reflex, Golgi tendon organ. Thank you so much, Dr. Anshita. Thank you. I have done some updates also. Yes, I have done some recent updates also. The recording has been uploaded as well, right? So stretch reflex, Golgi tendon organ, but please don't tax yourself. Stretch reflex, Golgi tendon organ. No, that is muscle spindle. And I'm so happy that I'm able to help you all, right? Reciprocal inhibition, again, muscle spindle. Okay, fine. Myotactic reflex, again, muscle spindle. But inverse stretch reflex is correct, which is Golgi tendon organ. Please revise all the reflexes from CNS. Very important topic in CNS physiology. Reflexes are a must know. No doubts about it, right? Everyone remembers what is reciprocal inhibition? Reciprocal inhibition is if I am stimulating the agonist muscle flexor, I am inhibiting the extensors. Stimulation of the agonist along with inhibition of the antagonist, right? Let's move to 17. This everyone has got correct. SK myotactic reflex, SK same है stretch reflex. लास्ट में कर दूंगा, ठीक है? लास्ट में आई विल डू फॉर यू एसके, मुझे याद दिला देना आप, ठीक है? लास्ट में आई विल डू. If the extracellular, so the other people, if they don't want to be there, they can leave the session and then I can do for you. If the extracellular concentration of calcium is 100, intracellular is 1, 2.3 RT upon F is 60. What is the equilibrium potential of calcium, assuming the cell membrane is freely permeable to calcium? Please look at this carefully. Nurse potential of calcium is equal to 2.3 RT upon ZF log to the base 10 C1 upon C2. Please see this carefully. This I have given you already in the option as 60. So equation reduces to 60. Valency of the calcium is 2, right? Then log to the base 10. This is 100 upon 1. Read this very carefully. Lot of people go wrong here. 100 upon 1 is actually 10 raised to the power 2. So 2 and 2 will cancel. The answer would be 60. Now remember, C1 is in the ECF. So more calcium in the ECF. Calcium will move from outside to inside. Nernst equation, that's correct. That is absolutely correct. Nernst equation. If the calcium starts accumulating inside, positive charge. What will positive charge do to calcium? Repulsion. Which gradient is becoming equal and opposite? Electrical gradient is becoming equal and opposite to concentration gradient, right? So the answer is actually plus 60. Very good. Absolutely correct. Remember, Nernst equation is used to calculate the Nernst potential. Yes, that's right. Inside is positive charge. That is why we are using positive sign. That's perfect answer. And remember, Goldman-Hodgkin-Katz equation is to calculate RMP. GHK is for RMP. Goldman-Hodgkin-Katz. Goldman-Hodgkin-Katz equation. Right, that is for RMP. Yes, RMP, that's right. Moving to 18. Least conduction velocity is seen in which of the following? These are actually one-liners, but they are very tricky ones. This will, ascertain your entire knowledge of Lloyd and Hunt and, Erlanger and Gasser classification. So the examiner is very smart. In one line, he is testing your entire knowledge. Remember, sensory fiber from Golgi tendon organ is corresponding to A alpha, which corresponds to 1A and 1B, right? Then motor fiber to muscle spindle is A gamma. Sensory fiber for Pacinian is vibration. Answer can only be this one because this is B fiber. And please remember, if I change the last option, see once again, if I change the last option and put it like this, now tell me which is the answer. No, that should not have happened. That should not have happened, Anshita. You should not have done that. Now tell me what is the best answer. Very good. Postganglionic autonomic fibers will now become the answer because this is option number. This is fiber C now. That's right. So as I go, the carry home message, as I go from A to C, the diameter decreases and velocity also decreases, right? Very, very important. Plus the problem is C fibers are unmyelinated. A fibers are thickly myelinated. Diameter is more. B fibers are thinly myelinated. Right? Yes, that's right. Moving to 19. In the histology section given below, which area relieves pain due to massage therapy? This is actually a PYQ, an old PYQ, but I just wanted to put it so as to make you, remind you all that you have to read about pain from physiology. It's a hardcore physiology topic. Read about the pain, each and everything, right? Spinal and supraspinal control both. Spinal and supraspinal control both. यश शर्मा बी नहीं दोबारा से देखिए यश शर्मा प्लीज सी केयरफुली बी नहीं है जस्ट सी दी आंसर बी तो इज इंटरमीडिएट हॉर्न बी ये वाला है दिस इज बी B is intermediate horn. This is not the answer. No, Faraz Sandhu. D कैसे हो सकता है? D is outside. अरे C is ventral horn भाई, क्या बोल रहे हो? अंशिता जैन, C is ventral horn. I hope you have not forgotten this basic thing. Confused हो गए हैं ना? You people got confused. Doesn't matter. Area तो Dr. MS, there is no need. Please see this. Pain fibers enter the dorsal horn. Dorsal horn. This is dorsal horn. The pain fiber is entering. The pain fiber enters dorsal horn. Lamina 2. Where is the lamina 2 present, which releases enkephalins? Substantia gelatinosa. It is dorsal horn. What is the dorsal horn? A. Right? Yes. Now you people are able to recap. Good. Right? So remember, lamina 2 releases pain inhibiting substances known by the name, which substances? Enkephalins. हाँ फराज संधू अब सही हो गया, ठीक है, बिल्कुल, एब्सोल्युटली करेक्ट, यू गॉट इट, गुड. लेट्स मूव टू द लास्ट वन, क्वेश्चन नंबर 20. अच्छा, इमेज ने कंफ्यूज कर दिया, ठीक है, तभी तो डाला है, ठीक है. क्वेश्चन नंबर 20. सो फॉलोइंग डायग्राम शोज द changes in hypothalamic set point and body temperature during fever. Which of the following will be seen at point B in comparison to A? This has actually become, hot favorite. So that is why I have given you today once more in a different form. Which of the following will occur at point B in comparison to point A in a patient who is having fever? Let me zoom this picture. Please see this. Remember, normal point is 98.4 degree Fahrenheit, right? 98.4. Now suddenly there is a rise in set point. That means this has become 103. How will the body try to match the increased set point? This happens due to release of interleukin 1 by the pyrogens, right? As soon as the set point increases, the body will try to match. How will it do so? Point number A, it is slowly trying to catch up. It will take time by increasing the heat production. By increasing heat production, shivering, and decreasing the heat loss, vasoconstriction. That's right. Then let's imagine that you have taken antipyretics, right? As you take antipyretics, immediately there will be drop in the set point. As the set point has reduced, but I am still at higher temperature, how will I match the set point? Now I will try to reduce my temperature. How will I reduce the temperature? This was increased heat production. Yes, absolutely correct. Piloerection will also occur in A, because piloerection will decrease the heat loss. More important in lower mammals where there are a lot of fur hairs. So in the B, I am doing increased heat loss. How? Vasodilation and sweating. Very good. Now let me see how many people have given the correct answer. So what happens in B as compared to A? The answer is sweating. Can you tell me another one? Yes, another one. Look at the figure again for me. In comparison to A and B, the anterior hypothalamus is stimulated at which one? A or B? Anterior hypothalamus, A or B? Anterior hypothalamus is stimulated where? A or B? Yes, anterior hypothalamus, A or B? Very good, that's right. Anterior hypothalamus is the cooling center. Perfect answer. Good, everyone. Anterior hypothalamus is the cooling center. Anterior is my AC. It cools me down. Anterior is my AC. But posterior increases the heat production. Very good. Please remember, as the question came in this year INICET, preoptic nucleus is a part of anterior. Preoptic nucleus is the part of anterior, and posterior is A, which will cause shivering. Very good. Yes, now please write down in the chat box truthfully how many people got all 20 correct. Anyone, or anyone who got more than 18 correct? नहीं, मेलेडी बी में तो कूल हो गया नहीं, बी में तो धीरे धीरे होगा ना कूल, बिकॉज सडन ड्रॉप इन सेट पॉइंट हो गया, तो बी विल हैव टू कूल स्लोली. 15 out of 20. गुड. यस, एनीवन हु गॉट? मुस्कान अग्रवाल 19. वेरी गुड, वेरी नाइस. यस, एसके अभी बता रहा हूँ, आई एम टेलिंग यू 16. नाउ प्लीज रिमेंबर, एनीबडी हु गॉट मोर देन 14 over here, your preparation is on track. Nothing to worry, right? Nothing to worry. So best of luck and best wishes from my side. Any query you have, just send me direct message on my WhatsApp number, right? Yes. मेलेडी बात समझ में आ गया? कूल सेट पॉइंट लूज हो गया, फटाफट सेट पॉइंट नीचे आ गया, बॉडी को टेम्परेचर लूज करने में टाइम लगेगा, तो एंटीरियर हाइपोथैलेमस काम करेगा, तो हीट लॉस और स्वेटिंग धीरे धीरे होगा. इसीलिए ये धीरे है, ये स्लोली हो रहा है, इसको टाइम लगेगा. एक बार आप वापस आ गए जो आप बोल रहे हो, उसके बाद कुछ नहीं होगा. नाउ उसके बाद नथिंग इज रिक्वायर्ड, राइट? यस यस, प्लीज रिवाइज. ओके मेलेडी, मसल स्पिंडल भी बता रहा हूं, और क्या था? मायोटैक्टिक. सो अदर पीपल कैन लीव नाउ. थैंक यू सो मच फॉर योर पेशेंट लिसनिंग. गॉड ब्लेस यू ऑल. टेक केयर. बेस्ट ऑफ लक. राइट, बेस्ट ऑफ लक. अरे डॉक्टर MS ऐसे मत बोलो यार, ऐसे मत बोलो. रिप्लाई तो करता हूं यार, ऐसे मत बोलो. अच्छा, अभी आपका क्वेश्चन देखता हूं, ठीक है? चलो, अभी मुझे दोबारा मैसेज भेज देना. थैंक यू. यस, चलिए, मायोटैक्टिक रिफ्लेक्स बता रहा हूं अब. प्लीज लिसन टू दिस. मायोटैक्टिक में दिस इज द डॉर्सल हॉर्न. ओके डॉक्टर MS, आई विल सी टुडे. आई वॉज बिजी इन रिकॉर्डिंग. आई विल सी टुडे. डोंट वरी, आई गेट टू यू. आई गेट बैक टू यू. एक बार मुझे आज रिमाइंड कर दो प्लीज. दिस इज द मसल. I am sorry about it, Dr. MS. I will reply to you by Sunday. Please send me again. This is the muscle spindle. These afferents are 1A and 2. This muscle spindle detects. This is the receptor muscle spindle. Afferents are 1A and 2. They bring the information to the ventral horn. Change in muscle length. Now this synapses with A alpha motor neuron, which will cause contraction of the large muscle fiber. This is known as myotactic or stretch reflex. Right? So how many synapses can you see? Only one. So this is also known as monosynaptic reflex. Fine. Yes, what else you were asking me? Muscle spindle. Muscle spindle, let's quickly recap. Muscle spindle. This is a large muscle fiber. Inside this, we have a muscle spindle which is having a bulge. The other one is straight, right? Because these fibers are inside the large muscle fiber, this is the large or the extrafusal muscle fiber. Inside this, these spindles are there. This one is known as न्यूक्लियर बैग, क्योंकि इसमें बैग है. सेंट्रल पार्ट इज लाइक अ बल्ज. this is nuclear chain because इसमें there is no bulge, right? Let's take out them over here. This is bag, this is another one which is bag, and this is like a chain, right? Now you just have to remember that in the bag the nuclei are arranged on the central portion. In the chain, the nuclei are arranged in chain like fashion. Okay? Just remember the afferents and efferents. The first one, afferents are 1A. This is nuclear bag dynamic. This is also having a bulge. It is having two afferents, 1A and type 2. This is known as nuclear bag static. Finally, last one में there is no bulge. This is 1A. This is again 2. This is known as nuclear chain static. Right? Now these are the afferents. 1A endings are known as annulospiral. Remember A for 1A, A for annulospiral. That is how you can remember. Annulospiral endings. Type 2 endings on the spindle are like this. They are known as flower spray endings. And finally the efferent. This is a gamma dynamic. This will supply these peripheral portions of the spindle. This is a gamma static. Right? That's it. So this takes care of our muscle spindle. Okay, Melody, I hope you are happy now, right? Chale, so we'll put an end to this session now. And yes, I will definitely answer your query. I was busy in something, but don't worry. Just send me once again if you have the repeated issues, right? Chale, thanks once again. Thank you so much. Bye. Take care. Yes, Melody, समझ आ गया? हाँ या ना तो बोल दो. You got me done this again. Chalo, okay, great. Let's stop here now. Thank you. This is the stretch reflex. This was spindle. Stretch reflex किसने पूछा था? Dr. MS, I think. चलिए, okay, we'll call it.